Hi everyone, I'm Sarah Pierce, and for my action item, I wrote a letter to Congress and state legislators addressing the cap on travel nurse pay. Most of it is by state instead of by country, but addressing it as a whole and each individual state would get the point across more directly. I chose to write a letter to address this because it is going into legislation. They want to put laws in place to cap pay so that travel nurses can't make above an X amount. Travel nurses are used in a rapid response, such as the pandemic, where resources are urgently needed. If we didn't have travel nurses, then the pandemic probably would have been much worse than it already was. It was already devastating. There were already staffing shortages, burnout, and if nurses didn't go to very high demand areas, then treatment would have been worse. There probably would have been more deaths. So travel nurses were huge in the pandemic. Travel nurses do receive higher compensation than a regular staff nurse, but they are also semi-inconvenienced. They are taken out of their home base, their area of what they know, and put into a completely new environment. They sign a contract for X amount of weeks, up to usually 13 weeks, and sometimes they can stay and continue if that need is still there, or they have to find another job. So they are constantly moving around. They're constantly finding housing accommodations. They're away from their families if they have them, friends. Or their travel is further than what it usually is. So they do give up a lot and sacrifice a lot to help out. So I do believe that their pay should be higher than a normal staff nurse that goes to the same place every day in the same unit. To address this, another way would be to fix the fundamental issues in healthcare, which would be staffing shortages. If we didn't have such a shortage of nurses, then we wouldn't require the use of travel nurses as often. There still will be a need for travel nurses, but it won't be as high, so the supply and demand wouldn't be there as it is now. Travel nurses increased by 35% in 2020. That was the height of the pandemic, and it expected to grow 40% in 2021. And the projected growth is more because the shortage of nursing is still there. That has not been addressed yet. According to the AACN, there is supposed to be a shortage by 2031 of almost 200,000 nurses. That is a lot. And with staffing shortages, then nurse-to-patient ratios are affected, so nurses are taking on more patients, which is a risk. It relates to poor safety, poor care, and adverse events. There's more risk involved with higher nurse-to-patient ratio. So addressing these issues of staffing shortages would ultimately lower the use of travel nurses, which would lower the supply and demand, which they wouldn't have such a high compensation, or they wouldn't be trying to get more. But I do believe that travel nurses shouldn't have a pay cap because they do what other people don't want to do. They move around, they change jobs all the time, they are away from friends and family, so their sacrifices are worth the extra money. But addressing the root cause of the issue with the shortage would ultimately address the travel nursing. But I did choose to write a letter to get their attention, multiple people's attention, instead of sitting in front of somebody and trying to have a conversation, trying to plan meetings, that doesn't always work. Conflict of schedules. It's difficult to plan a meeting with a congressman or a state legislator. So writing a letter and sending it out, then they can read it. They have the information in front of them. If they want to reread it, go back. And then you can follow up with another email or another letter, an email, a phone call with the information and see if they got it, how they feel about it, or go to meetings and address the topic. But I think a letter is a more professional way to address this topic, and easier than trying to schedule a meeting or a sit down with a congressperson, because they are so busy like the rest of us, but they're very hard to get with. So I do think a letter was the best option for this, and hopefully it will change how they view travel nurses and how it isn't a price gouging or a negative. It's beneficial to healthcare, especially as a nurse who worked in the hospital during the pandemic, and we were short every day and it was exhausting, which does lead to nurse burnout, which goes into nurse shortage even more. But thank you for listening. Hope you have a good day.